Okay, good afternoon, guys. I hope you hear me. Can you please turn on your camera because I should to see the students. This is the rules of university. So please, I request you follow the rules. Turn on your camera. Then also, I will put attendance if you turn on your camera when I see you. Okay, guys. Today, actually, I would like about my subject, like introduction of my subject. Can you tell me, please, uh, what what does my proper therapy course study? Everybody turn on your camera because if you will turn off your camera, I will put absent. Sajar Abbas, questions for you. Can you tell me, please, what
Yes,
does my
ma'am.
subject study? Sajar Abbas, it was the questions for you.
Ma'am, internal medicine is the dealing prevention, diagnosis, and treatment internal diseases.
Okay. No, my subject study introducing to the clinic. It is something that introducing to go to the clinical subjects, something like a base of the clinic. That's why it's important to study. This is the course, proper therapy, propaedeutics of internal medicine. Okay,
Yes, ma'am.
guys, I want to ask some questions. What does mean preventing, Alina?
Yes, ma'am.
What does mean preventing?
Uh, Ma'am, it's like something prevent to keep something from happening.
Okay. For
Yes,
example,
ma'am.
an example, can you give me?
Um, for example, as ma'am, wet weather as before preventions like after when we ill, we use some preventions.
No, no. If you ill, so it means you get the diagnosis. Prevention, it means prophylactics. It means, for example, make a vaccination. Vaccinations, it is the prevention our people from the future or coming diseases. Okay?
Okay, ma'am.
Can you tell me, please, what does mean diagnosing a leader of group Kafaria? Kafaria, what does it mean diagnosing? You hear me? Kafaria, I will put absent to you.
Yes, ma'am. Ma'am, my internet connection is very slow at that moment.
I
Hello?
don't know, but solve this problem. If you have practices with
Hello.
me, you should to be at the class. Kafar Yar, can you tell me please what has been diagnosing?
Ma'am, can you repeat, please? Hello.
What does it mean diagnosing?
Ma'am, my internet connection is very slow. That's why I can't hear you. Hello.
Okay,
Ma'am,
Sajar Abbas, what does mean diagnosing?
ma'am,
Ma'am, diagnosis is the process of
hello.
determining which disease or conditions explain person's symptoms and signs.
Okay, it means the result of all the symptoms, syndromes, your examinations, and we can get diagnosing, right?
Hello. Ma'am, can you hear me? Hello.
Yes, I can hear you, Havar, but
Hello.
you cannot hear us.
Ma'am, I have internet problem. Ma'am, my internet is very slow at that moment. Hello.
Okay, okay. Okay, then I would like to talk mm, about the diagnosis and diagnostics. Please read the slide. Read the slide, Bilal Ahmad. You hear me?
Diagnosis, ma'am.
Yes, read the
Diagnosis.
slide. What does mean diagnosis and diagnostics? This is the two different words. Read the slide.
Okay, ma'am. Okay. Diagnosis or diagnostics. Diagnostic through gnosis knowledge is the science of method by which disease are identified. Process of identifying a medical condition or disease by its sign and symptom, and from the result of various diagnostic procedure. The conclusion reached through this process is called diagnosis. Diagnosis criteria combination of symptoms which allow the doctor to ascertain the diagnosis of the respective disease.
Okay. Read. So you can see, can you tell me please, what is the differences between the diagnosis and diagnostics below?
Ma'am, yes, ma'am. Ma'am, diagnosis, not, but they are not different. Process of identification of medical condition disease by its diagnostic criteria combination of symptoms which allow doctor to
What does it mean, diagnosis or diagnostics?
diagnosis
Okay,
may
who can
identify.
help? Who can say?
Ma'am, I think so. Diagnostic is the science of method by which disease are identified, and diagnosis is also investigation and analysis.
No, guys, I am agree with the diagnostics. I am agree with you. The diagnostics, it is the way, method, or it is the examinations method,
Yes,
examination patients, we call diagnostics. But diagnosis, it means when you reach the result of your examinations, we call diagnosis, and we can give full name of this diagnosis. Thank you. Can you read the next slide, please?
Yes, ma'am. Diagnosis are diagnostic. Diagnostics include medical diagnostic technique, the study of methods of observation and examination of the patient, physical and laboratory instrumental method. Number two, semiology, GK semion, sign or symptomology, study of the diagnostic value of the symptom of the disease. Diagnostic method, study of special way of pondering aimed at identification of the disease.
So see, guys, actually we have different method of diagnostics. We have physical examination, laboratory instrumental methods. We have semiology diagnostics. It means when you are collect all the symptoms of the diseases. And we have the like study of special ways of the to identify of the disease. Also like something special test or something special um, uh, investigations that can we get diagnosis. It is understandable for you guys.
yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So my subject or the goals of my subject, it is the what? It is the get to know how to get diagnosis, how to get right diagnosis. My subject is study the way of getting the diagnosis. And can you tell me, please, what does it mean, symptom? Uh, Sajarabas, what does it mean, symptom?
Ma'am, symptoms means a personal feature which is regarding condition of disease, indicating of disease.
Example,
Example,
please.
stomach cramps, headache, fatigue, like
Example.
ma'am, like fatigue, headache, stomach cramps.
Okay. What does it mean, signs? And what is the difference between signs and symptoms? Can you tell me, please? What does it mean,
Ma'am,
signs? Sajarabas.
Yes, ma'am.
What does mean signs? And what is the differences between signs and symptoms? You know or you don't know?
Ma'am, gesture signs mean like
Signs. We have signs and we have symptoms. So can you tell me, please, what is the differences between symptom and between symptom and signs?
ma'am, I explained symptoms, but I don't know about signs.
Signs, symptoms. This is the when the patient complain to you and saying, "I have a headache. I feel this one. I'm this one." Signs when the doctor see and they can give the diagnosis. Signs, for example,
ma'am,
temperature. The doctor can check the temperature of the patient and say, yes, this is the high temperature. This is the sign. And temperature, it is also the symptom. So sometimes the signs and symptoms can be the same, something like a temperature. Or when the doctor go and check the blood pressure and say, oh, your blood pressure is the up, this is the signs. So symptoms, it is the subjectively method. There is what? There is feel patient and say by his word. See
Okay, ma'am.
signs, it is the when the doctor check and can prove there is the signs and give the diagnosis. Is it understandable?
Yes, ma'am.
Okay. Next slide, I would like read Farah. Farah, turn on your camera. If you are not turn off your camera, I put absent. Farah, turn on your camera. Okay, I put absent.
Yes, ma'am, I have turned on.
So please tell me, please read the slide. Unmute yourself and read the slide.
Symptoms, symptoma or sign, a sign, appearance of disease according to patient's subjective feeling or objectively detected by a physician. Syndrome, the set of symptoms based on common pathogenesis.
Okay, so you see, guys, what does mean symptom and what does mean syndrome? Can you tell me, please, an example of symptom, Farah? Farah,
Okay, ma'am. Yes, yes, ma'am.
tell me, please.
Symptoms are visible to a patient, but not the doctor. Like we feel cramps when it is a sign, but it cannot be seen by the doctor. It is a symptom that we feel cramps in our belly.
Okay, okay. Can you give me the example of syndrome?
Syndrome, there are many examples, we can also say that Turner syndrome. uh, in Turner syndrome, we see that one X is missing.
Syndrome, guys, this is the set of
And
symptoms, but they have one common pathogenesis. Can you give me, please, an example?
Down syndrome.
Pathogenesis should be one.
Turner syndrome,
Can you give me, please?
ma'am, Turner syndrome,
Turner
in which one
syndrome.
X is missing, web symptoms.
Okay,
That
okay.
symptoms are web neck, short height, short
Um,
stature,
no, you know, this is the like
and
something
mental environment is
medically,
also.
genetically disease.
Ma'am, syndrome is inherited by
For
is genetically
example,
Down
For
syndrome, which is
example, obstructive bronchial obstructive syndrome. You know, we have the
yes,
syndrome bronchial obstructive syndrome when the bronchus is spasm, constrict, and the patient cannot normally breathe. So patient will have short of breathness, coughing, and maybe the pain, chest pain. So it will be what? It will be syndrome, obstructive bronchial syndrome, because they have one pathogenesis. You will understand it, guys, when you will study pathophysiology. Never forget, pathophysiology very, very related with all the clinical studying. Okay, thank you. Um, I would like to talk about the method. Before talking about the method, I want to show this slide. In this slide, you can see internal medicine specialists. So you should already now choose what you want to be, what kind of specialist you want to be. But never forget, all the body, all the specialists, they are related to each other. That's why you study whole 5 years. All this is the specialist, this is the diseases. Then after 5 years graduations, you can choose more, more what you want, what you would like after 5 years studying of these specialties. So what kind of cardiology, pulmonary? You know, guys, my subject, and I'm a therapist. Therapist, it is something like a general doctor, something like a general physician doctor. So therapist consists of the systems like a cardiology, pulmonary, GIT, nephrology, and rheumatology. So this is the 5 symptoms we will study in the therapy. Others, other specialists, other systems like oncology, infection disease, neurology, psychiatry, you will study with other teachers. Okay, is it understandable?
Yes, ma'am.
Okay, uh, let's talk about method of the investigations of the patient. Can you tell me, please, what kind of method of the checking of the patients do you know, Alina? Alina,
Yes, ma'am.
tell me please, what kind of methods of the check-in patient do you know already? Who knows? Who can answer
Ma'am,
my questions?
there are different methods like we usually do X-ray, ultrasounds, taking Siemens, and by if we have some pulmonary, then we use stethoscope. These are the methods for diagnosis
Yes,
disease.
you are right, but you should to make a plan in your mind. You cannot mix everything. We have two category of method of the examination of the patient. If you see at the picture, okay, this is next picture. What does she do?
Ma'am, taking history or making reports.
Yes, the subjective method, one of the method categories, it is the what? Taking history. It
Yes, ma'am.
taking history or we call anamnesis. Can you tell me please, Alina, what is the next, what is the other methods? How we call it?
Ma'am, next also palpation,
Okay,
auscultation,
okay, yes. What else?
also menstruation.
No, we have inspection, we have
Yes, ma'am.
palpation, percussion, and auscultation. This is the called physical examination. We call all of these palpation, percussion, inspection, auscultation, we call physical examination. So they are objective method, okay? Objective method. So subjective method
Yes, ma'am.
of the patient is the what?
Ma'am, I think so. Giving medicine.
No, you don't understand me. We have two methods of the what? Of the check-in patient. One of
Checking
them we
patient.
call case history, interview of the patient, and we can get good, normal, right case history. Okay?
Yes.
What does she do? She is writing in something. She is taking the interview and put in your case history information of this patient. This is the first step. Your first step, it is the taking the case history. The next step, when you done with the case history, you go and physically check the patient. Understandable?
Yes,
You
ma'am.
go and check the patient physically. So then when we done with the case history, we do inspection, palpation, percussion, and auscultation. Okay?
Yes, ma'am.
Today I would like to talk about the case history, actually. Case history. In next slide, I can show to you, this is the palpation. This is the also palpation. This is the percussion. This is the auscultation. And then the third step, it is the what? When we send the patient to the laboratory
Mm,
investigations,
Simon.
or when we send to the patient to the blood test and everything else. This is the final examinations. Okay. So in my subject, we will study step by step how to take the case history of different systems, how to investigate physical examinations from different systems, and what is the most commonly used instrumental or laboratory tests. Okay. Okay, let's see. This is the case history. What do you see at the slide? You see the case history? You see the case history or taking history Or in, guys, in Greek word, we call anamnesis. Okay, anamnesis. I
Yes.
will always say anamnesis. Can you tell me, please, anamnesis consists of what? Anamnesis consists of what? Bilal. Anamnesis consists of what?
Sorry, ma'am.
Ma'am, criminal record like
Components. I need a components of the case history. Case
family
history
history.
consists of what?
Family history.
Yes, one of the points is the family history. What else?
Past medical history.
Yes, what else?
Social and personal history.
Okay, what else?
Uh, what else, ma'am? Drug and allergy
Okay, what else?
system review.
What else?
Ma'am,
You forget
no.
about the very main important points. You forget about
Preventive.
the personal date, record the personal date of the patient, and you forget
Yes,
about the chief complaints. Okay?
yes, ma'am.
So actually, you can see here is we have subjective and objective what? Subjective and objective method of examinations. Here is anamnesis. Read the slide. Uh, Farah, not Bilal. Wait. Farah, read the slide.
She left.
She left. Why?
Ma'am, I think her internet is issue because she joined and again left. She joined and again left.
Okay. Okay, Alina, read the slide.
Yes, ma'am. Anamnesis, history take, recollection, a medical or psychiatric patient case history, particularly using the patient's recollections, is a set of information about the patient obtained by questioning.
So see, guys, history taking we can call also anamnesis. Anamnesis actually it comes from the Greek language and it is means memory. So memory, it is actually if we translate from Greek words the exactly properly the word anamnesis, it will be memory. So okay, so we understand we will call the history take anamnesis. Okay.
Anamnesis and history are same, ma'am.
Hmm.
Yes, anamnesis and the history taking, it is the same name. Okay.
Yes, ma'am.
So in this slide, you can see the components of the anamnesis. What you forget? You forget to tell me about the identifying date and source of the history.
Yes, ma'am.
Then we go chief complaints. Then we go present illness. Then we go past history. Then family history. Then personal and social history. Then review of system. This is the scheme, or this is the like a point that you cannot um, say confusing. You should to follow step by step. Number one, it is the identifying date. You cannot start from the family history or you cannot start from the present illness. Number one is the identifying date. Can you tell me please what does it mean? Can you tell me please what does it mean? Sajarabas.
Yes, ma'am. Yes.
Can you tell me please what does it mean?
Point number one, ma'am.
Identifying date. Can you tell me please what does it mean?
Identifying data.
Huh?
Ma'am, it's like when the patients uh, suffer with disease.
No, it is like when we record the personals of the patients. Read this slide, Sajjad Abbas. Read the slide.
Ma'am, patient history and physical exam is the cornerstone of medical diagnosis. Importance of history taking. Obtaining an accurate history is the critical first step in determining the etiology of patient's problem.
Okay, keep going.
Talking a good history, Taking a good history and physical examination will lead to the correct diagnosis 90% of the time.
So you see, guys, first of all, not to send to the ultrasounds, X-ray, or whatever instrumental diagnosis. First of all, you should to get a good history and then do the physical examination. And then you will send the patient to the other method of investigation. Okay? Okay, let's talk about the identifying date. Identifying date or record personal details. Read the slide, Alina. Alina.
Yes, ma'am. Record personal details. Always record personal details. Yes, ma'am. Name, age, address, sex, occupation, religion, marital status, record date of examination and admission. Mr. Ali
Okay,
Khan, 55
wait,
year.
Alina. Wait.
Yes, ma'am.
Alina, you are a doctor. I am a patient. What you will do with me?
First of all, I will ask your name, then age, address,
So ask
then
me.
all the things.
Ask me. I am a patient. You are a doctor. Ask me.
Yes. What is your name?
My name is Guljan.
Your age?
Is it enough for you? My name is Guljan. It is enough for you.
Yes, ma'am. I think so.
Why it is? We have 1 million Guljan. What you should to ask?
Ma'am,
My
family
full
name.
name. You should to
Yes,
ask my
family name.
full name. Guljan Almazbek kızı. My full name. Then next
Okay,
one.
ma'am. Then age?
I'm 30 years old. I'm old lady. Next one.
Yes, ma'am. Next, your sex?
I am
What
male. Oh, I'm female. I'm sorry.
Yeah. Yes, ma'am. Your marital status?
I'm married.
Okay.
अलीना क्या
Record
पूछ रहे
date.
हो,
Next,
खैरियत है?
we will try to record date. On which date you have visited us,
Which
and
date? Tell
we
me, please,
admit.
today's date.
Ma'am, 1st April.
Ma'am, it's 1st April.
2021.
1st April, 2021.
2021. And
Yes,
time. Don't
and then
forget about
admission
the
time.
time. What is the
Yes,
time?
3:14
Okay, you are in
here.
Pakistan.
Yes, ma'am.
Okay. Thank you, Alina. So see, guys, you should to record the personal details very carefully and very do not forget everything. Like if you ask the name, not only name, you should to know the surname. Okay, the source of history. What does mean the source of history? Bilal, read the slide.
The source of history or referrer can be patient or familial member or friend and officer, a consult or the clinical record. Identifying the source of refer helps you assess the quality of referral information. Question you may need to address in your assessment and write a response.
Can you tell me, please, how you understand it? How you understand what does it mean source of history?
First, we take a history of patient. Uh, Friend and officer.
Who understand it? Who can explain me? Sajarabas, maybe you try.
Yes, ma'am. Source of history means, ma'am, and me the
Ma'am, I understand.
Okay, please.
Ma'am, can you tell?
Uh, Ma'am, it is about
Hello.
on which patients came with a friend or mother reference point.
Okay, so it means information. If, for example, the patient is emergency, the patient is no consciousness, right? Lost the consciousness. So
Yes,
you
ma'am.
cannot talk with the patient. You talk with the whom come the patient with whom. For example, parents, relatives, friends. So you should to put the information by whom? By, for example, friends. Okay, it is also important because why it is important, guys?
Because ma'am, if
Because
patient
Because
dies or
patient is severe
something
trauma.
happening, they inform their reference point or
no,
Patient are
because
not able to
case
touch.
history, it is the legal document. It is the protection document. You only by the case history can protect yourself from the police station or something happen with the patient. You should to protect yourself in only case history. It is the legal document. If you will write this document right way, then you can easily protect. There is no you're guilty. There is this is the informations, for example, gives the friends, or this is the informations, for example, gives the grandmother. So thus, you try to protect of yourself. That's why, guys, remember one thing. When you write the case history, you write the case history for the police station, for the prosecutor. You write the case history not for yourself, not for the patient. You write the case history for the prosecutor, for the police station. Okay?
okay,
Okay,
ma'am.
guys, let's talk about the chief complaint. Bilal, what do you know about the chief complaint?
Ma'am, it's about
Bilal, what do you know
the
about the chief
what the
complaint?
patient is feeling.
I want to listen, Bilal.
Yes, ma'am.
What does it mean, chief complaint?
Ma'am, chief complaint patient are severe trauma or not severe trauma like this.
Okay, you are a doctor, I am a patient. Ask me.
Только курение chili free. Курение. Chicken, да?
Okay, Alina, can you tell me, please? You are a doctor, I am a patient.
Yes, ma'am. Okay. Please tell me what's your problem or what symptoms you observe in yourself.
Doctor, I have a headache.
Okay. Also,
So you will put the headache where in the chief complaints. Okay.
yes, ma'am.
The next one, Alina.
Next, you have severe headache or
No,
it's
wait,
normal.
Alina. Read the slide.
Okay,
Wait.
okay.
Read the slide, Alina.
Okay, okay, ma'am. Definition: the one or more symptoms or concern causing the patient to seek care. The main reason pushing the patient to seek for visiting a physician or for help. Extra chest pain, palpitation, shortness of breath, ankle swelling, etc. The patient described the problem in their own words. It's recorded in the patient's own words. Possible question: what bring you here? How can I help you? What seemed to be the problem?
Okay, so see, you asked me how can I help you? So you are a
What
doctor,
is
I'm a
your
patient.
yes, ma'am? I can. If you are patient, then I will ask you from you what's your problem
So
and
I
what
said I have
symptoms
a
you observe
headache.
in yourself.
Okay, I said I have a
Yes,
headache.
I will
What
put.
we will do the next one at the history of present illness. The next point is the history of the present illness. What will we will do here, Alina?
Ma'am, then I will also ask the headache. It's severe or it's normal that you come here.
Okay, what else you will ask to me?
Yes.
What else?
Then then I also ask it's
Then
something
present company.
ma'am, for example, if we have headache, then we have also like restless in condition. So I will
Okay,
also
look at this.
ask.
This is the something like a scheme that you should to follow when you are asking about the
Duration.
complaints and putting the history of present illness. Number one, it is the duration, write in your copybooks. Number two, it is the onset, sudden or gradually. Number three, what has happened since, constant or periodically, frequency getting worse or better. Number four, precipitating or relieving factors. Number six, associated symptoms. So, Alina, you should to follow this is scheme. Okay?
Yes, ma'am. Okay.
Again, let's try. You are a doctor, I am a patient. I said I have a headache. Then
Okay. Then tell me what's duration of its headache.
2 days. I have headache like 2 days.
Okay. Okay. It's sudden or gradual.
It is happened suddenly.
Okay. What's happening since constantly or periodic?
Constantly. I have a very bad headache constantly because of students. Then,
Then also associated symptom. Then you have also headache in your have you have also pain in your eyes or migraine.
no, not, don't ask you. You cannot ask like that. You should to say
Okay.
me, did you take
Mm,
some medicine or not?
okay.
I
Did you
say to
take
you,
some medicine?
yes, I try to take paracetamol or Panadol, but it doesn't help me. So I'm getting worse. That's why I come to you. Okay.
Okay.
Precipitating or relieving
And
factors,
associated
it
symptom.
means what? What does it mean precipitating? What was the reason of my headache? For example, students I try to explain my topics to the students, so that's why I have my headache 2 days. This is the will be precipitating factors. Relieving factors when I go
You
home
take
and
some
have a
medicine.
rest. This is the relieving factors. A little bit my headache decreasing. Okay, understand me?
Yes, ma'am.
Okay, ma'am.
The next one, Alina,
Yes, ma'am.
you ask about the what more or what another symptoms disturb
Associated
me.
symptoms.
Yes, you should ask me what is more or associated
Yes.
symptoms disturb me. And I say to you, nothing more. I have only headache. Is it understandable?
Okay, ma'am.
So see guys, in the history
Yes,
of the
ma'am.
present illness, you should to follow this is the scheme. If you will follow scheme, if you will follow scale, if you will follow timetable, schedule, or the structures, you will never confuse. because in your mind you will study a lot of information, a lot of diseases. That's why you need to keep in your mind the consequently or the scheme of these points. For example, for the history of present illness, you need to ask about durations, then onset, then what has happened since, then precipitated relieving, then associated symptoms. Then when you are will get all these informations, where we go, Alina?
Then we go, ma'am, for diagnosis. No,
No, then we will
for medicine.
go past medical history.
Yes.
Then we will go to the past medical history. Read the slide, Sajar.
Yes, ma'am.
Read the slide.
Past medical history provides information about what medical problems the patient has had in the past and the potential problems that might be in the patient's future. Past medical history includes what chronic illnesses does the patient have, if any? Is the patient taking any medication? Past hospitalizations. Does the patient have a primary care physician? Allergies.
Okay, Alina, what we will do now with me? I have headache and I say to you all my present illness history. Then what you will ask me?
Okay. You have any chronic illness?
No, I don't have.
Are you taking any medications?
No, I don't. No, I take Panadol.
Yeah. Past hospitalization due to this disease or something else?
No,
You
this is
have
my
any
first
surgery
time.
or something?
No, no, I didn't
Have
hospitalized.
okay. Uh, have primary care physician?
It means I come only for to you. I didn't go to another doctors.
Yes, yes. Do you have
Any
visited any other hospital or clinic?
what? Excuse me, can you repeat?
Do you have visited any other hospital or clinic?
No, no, no. I come only to you. They say you are a very good
Okay.
doctor.
Okay. Have you any allergic something
Yes, I
with
have allergy for the medicine amoxicillin. I have allergy from the amoxicillin
yes.
antibiotic. Okay, and you know, guys, it
Okay.
is
Then
very
I will not
important
recommend
point.
this medicine to you.
Yes, yes, Alina. Thank you so much. That's why,
Thank you.
guys, you should always remember about the allergies, about the allergy from drug, from medicine. If you give the some patient, for example, if you give me amoxicillin and you forget that I have allergy and I take this amoxicillin, I can die from allergic shock. Okay? Okay.
Yes, ma'am.
The next one, what is the important? You also need to ask about the childhood illness, like measles, rubella, chickenpox, about also adult illness, about the
Yes.
medical like diabetes, hypertension, surgical state, obstetric or gynecological state, psychiatric state of the patient, and put in your past medical history. Then we go to the family history. Read the slide below. Below,
Family history. Yes, ma'am.
read the slide.
Family history. What about the patient genetic makeup put them at risk for particular disorder? Any familial disease are asked, for example, sickle cell disease, hypertension, high blood pressure, diabetes mellitus.
Okay, so how you understand it, Bilal?
Ma'am, in this topic, or genetic disease like sickle cell disease or sickle cell anemia.
So
And
I am a doctor, I am a patient, you are a doctor. What you will ask me?
ma'am, first, what is your name?
No, we
Like,
are talking about the family history. What you will ask about the family history from me?
um, present illness and past history. Yes, ma'am.
You don't understand. Alina, help.
Family history. Have your family any genetic disease or something else?
No, my family doesn't have any genetical disease and they are fine. See, guys,
Okay.
family history, you should also remember this one because we have a lot of problem with the diabetes or with the hypertensions. This is the disease we have really problems of this one, and they are mostly comes from the family genetics.
Yes, ma'am.
Okay, the next one, where we go? We go to the social history, includes educational level, occupation and occupational exposure, travel history, marital status, children, network of support, barriers to health care access, barriers to patient compliance, substance abuse history, etc. So it is also important the social history of the patient because like environment and social life can what to do also influence to get the diseases. For you guys, I have a job
Ma'am,
right now. You should open your copybooks and you should to write the dialogue between the patient and doctors. For example, Alina, you write, you are a doctor, Bilal is a patient.
Yes, ma'am.
Farah, you are a doctor. Kafar Yar is the patient. Sajar Abbas, you are a doctor. I am a patient. I give you 10 minutes for this one. Okay?
Yes, ma'am.
10 minutes. Write in your copybooks, then you will
okay,
answer for me. And one thing, follow the scheme, follow the plan.
Yes, ma'am.
okay, ma'am.
Uh, hello, Lina.
हाँ जी,
आपने अपने कापी में लिख लिया एक दूसरे के साथ बात करने
मैं
के लिए?
लिखती हूँ ना। तुम बस आंसर ही करना है क्योंकि डॉक्टर मैं हूँ ना, तो मैं वो लिख लेती हूँ सारी डिजीजेस। क्या क्या मैंने पूछना है, आप बस आंसर कर देना मुझे। ठीक है।
ठीक है, तो आप क्या अभी लिख रहे हो ना, कौन सी डिजीज के बारे में लिख रहे हो?
सिंपल हिस्ट्री टेकिंग।
सही सही। और मैं क्या लिख लूं?
तुम
लीना,
बस मुझे उसके आंसर दे देना।
लीना
हाँ
से
जी।
बात सुनो, बात सुनो। मेरी मैम ने एब्सेंट है ये।
नहीं नहीं,
यार मेरा नेट ही
मैम
स्लो
को
था।
पता है।
मैं
हाँ
बोल
कोई नहीं,
रहा
मैम को पता लग
था।
गया था।
कुछ करने है क्या बेटा टास्क है?
हाँ वो मैम ने कहा है कि लिखो ना, मतलब हिस्ट्री टेकिंग, एक डॉक्टर बन जो, एक पेशेंट बन जो, तुम्हारा फरा के साथ है। तो
अच्छा मैं
पता
क्या
नहीं तुम
डॉक्टर
डॉक्टर
बनूंगा?
के वो है, तो आपने
फरा
हाँ बन जाओ वो।
फरा अब
ओ,
मैम का सुना है कि उसने क्या कहा?
मैं
मैम ने
डॉक्टर बन जाऊं कि आपने डॉक्टर बनना है?
डॉक्टर तो
डिजीज का
दोनों ने
नहीं,
बनना है,
सिंपल
लेकिन अभी
हिस्ट्री
फिर
टेकिंग का
सिर्फ
बोला
मैं
है ना?
मरीज बन जाता हूँ। मैं मरीज बन जाता हूँ, आप डॉक्टर बन जाओ, जाओ मजे करो।
यार ये मेरा डॉक्टर है कवार यार।
नहीं, अगर अगर आप बन जाओ डॉक्टर तो ज्यादा बेस्ट है, मेरा काम
अच्छा
आसान हो
ओके,
जाएगा।
आप बन लो यार, क्योंकि मैं लेक्चर नहीं सुना था, मैं बाहर जाना, तो आप बन जाओ।
जो मर्जी बन जाए, मेरा तो मैम खास।
जजवार
अच्छा
और
ठीक
अलीना
है,
यहाँ
मैं
हमारे
लिख लूं।
स्पेशलिस्ट डॉक्टर हैं। स्पेशलिस्ट शजवार अब्बास और अलीना शहजादी। कोई दवाई शवाई दो यार, इलाज करो हम उनका भी।
हमें खुद नहीं मिलती है।
और
नहीं
मैं आपको क्या बोलूंगा कि मेरा सर दर्द कर रहा है, क्या है?
मैं
नहीं, मैं
हिस्ट्री
तुमसे
लूँ वो
पूछती जाऊंगी ना।
सही सही सही। बस थोड़ा आसान आसान सा क्वेश्चन करो।
पर रेडी नहीं करना, क्या करना है या मैं आपको खुद बताता जाऊँ? हेलो।
डायलॉग ही है वो, बस तैयार करना है, पूछना है एक दूसरे से, और तो कुछ भी नहीं है।
क्या करना है?
डायलॉग है ना।
अच्छा, डायलॉग्स करने हैं, डायलॉग।
हाँ, डेट टाइम।
If you done, guys, we can start, or you need
नो
time.
मैम, जस्ट 5 to 5 minutes.
5 minutes, okay, guys.
Yes.
Okay, guys, let's start. We don't have a lot of time, so please. Alina, if you are ready, can we start?
Yes, ma'am.
Okay, please.
Okay. Ma'am, first of all, history includes components, identifying data, a source of
No,
history, then
Alina,
yes,
I
ma'am.
need I need talking conversations between you and Bilal. Bilal is your patient, right?
Okay.
Yes. So you are a doctor, Bilal is a patient.
चलो ठीक है.
Yes, ma'am.
Okay, Bilal. Um, what's your name?
My name is Bilal Ahmad.
Age?
Age 20. 20-year old.
Your sex? Your sex?
Male.
Male or female?
दो male. Male लिख लो.
Male. Okay. लिख लो.
बड़ा सोच के बोला।
Occupation? Your occupation?
I am senior surgeon.
Okay. Then, ma'am, I will write date. It's 1st
No,
April
you
and
forget
time
ask
3:40.
about the married. Does he married? Is he
Oh, marital
married?
status. Your marital status?
Marital status क्या होता है? मेरी?
Are you
भी
married?
शादीशुदा है
No.
कि नहीं?
No, no, no. Allah correct me.
Alina, pay attention, he is single. Keep going.
Yes, ma'am. Okay. Then I will come to the point of chief complaints. What is your problem? I think so,
My
reference point.
favor.
No, ma'am. First,
Last cause.
sorry. Then I will go to the point of reference. If he is unconscious states, then what is your reference point? Which by whom you came here? Okay, then I will go to the point of chief complaints. Okay, Blad.
Yes.
What is your problem?
I have severe pain on leg.
Severe pain in your leg? Okay.
Yes.
It's a sudden or gradual?
No periodically, but rose.
Okay. It's constantly or frequencies. It's worse or better. Getting worse or better,
No
or then
periodically,
pretty constant.
periodically, but severe.
Okay. Have you any taking relieving factors?
Yes. Pain reliever I use.
Okay. Have you any associated symptoms with your this disease? Something like you have also pain in your arm or something. Some area.
No, no.
Okay. Uh, then, ma'am, I will go to the point of family history.
Okay,
Mm,
go.
okay. Have you any genetic disease or some disease like sickle cell anemia in your family
Yes. My father is sickle cell anemia patient.
from beginning or अभी से हुआ है इनको मतलब कब से है?
From beginning.
Okay. Then have you any then have you any your childhood history, past history, something you might have disease, the disease in your childhood like polio or something. measles वगैरह.
Yeah. No, no, no.
Uh, no.
Okay,
Measles, yes, measles.
okay, okay, Alina.
Yes,
Thank you
ma'am.
so much. It was very good dialogue conversations between you and Bilal.
Thank you.
Okay.
What you should
Thank
to
you.
do, guys, you should to write all these dialogues by yourself. Everybody do the dialogue between the patient and doctors, and you should to submit in the Moodle. Moodle, it will be task number 2, and the Moodle is written task number 2. You should to submit this one, okay? And
Okay,
Okay.
ma'am.
guys, I want to say one more thing more about the case history. More better, you should to follow McLeod's examination books. Okay, they give very good explanations about the case history and about the criteria, about the scheme, how to follow and everything else. Because at the lecture or at the practices, it is not enough time to give to you full information. So that's why I guide you and I say to you also open the book of MacLeod's examinations and read it. Not pediatrics. We are study not children diseases. We are study proper therapy, therapies, adult diseases. Okay, so please don't confuse. Most of you think it is the pediatrics disease, pediatric subject. No, it is the adult subject, adult therapies. Just only the words propedeutrics maybe confuse you. That's why you should to use MacLeod's examinations. Then also you can use Hodgkin's books method of examinations. Harrison, also very good book. So all these books is in the Moodle. Okay, you should to submit the dialogue and you should to submit the first task. And remember one thing, if you want to get to pass my course, you should to get 110 points more. So it depends on your activities at the practices, at the Zoom practices. If you active, I will give to you good points. If you passive, I will give you bad points. So remember this one. And one more thing, your homework for the next Zoom practices, general examinations. I will ask about the general examinations. So you must learn by heart all the things of general examinations. My lectures is also in the Moodle. You can upload it, you can load it, my lectures from the Moodle. Okay?
Okay, ma'am.
Okay, thank you guys. See
Thank
you for the
you.
next time.
Inshallah, we'll see you.
Okay, ma'am.